Hello, happy Golfers Day. I'm Dean Trevlyn. I'm a orthopedic surgeon with Premier Orthopedics, and we're here at our office in Broomall, Pennsylvania.
How you doing, everybody? Happy Golfers Day. I'm Matt Robinson. I'm a physical therapist assistant here at the Physical Therapy Clinic at Premier Physical Therapy in Broomall.
So today we're going to talk about some of the common golf injuries that we see. One of the most common is going to be an injury to the elbow. There can be what we call golfer's elbow, which is an injury to the inner side of the elbow. And then we can have tennis elbow, which is an injury to the outer side of the elbow. Believe it or not, these two are just as common with golf. Just because it's called tennis elbow doesn't mean you have to be playing tennis to get it. Golfers can get it just as well. The idea of these two injuries, it's an overuse. All of the muscles that control this side of the forearm all attach in a small part of the elbow on the inner side, and all of the muscles that control this side of the elbow all attach on the small part of the elbow on the outer side. With repetitive use and with tightness of those muscles, we can develop small internal tearing of those muscles, which causes pain. We can also develop inflammation in those muscles, which causes pain. When that happens, that would typically be a fairly sharp pain on the inner side of the elbow, which would be the golfer's elbow, or a fairly sharp pain on the outer side of the elbow, which would be the tennis elbow. Both of these can be treated in a very similar way, which involves stretching of those muscles, avoiding some of the activities that make it hurt, and then sometimes using ice or anti-inflammatory medication as well.
So the big thing that we see here with a lot of our golfers coming in with the medial lateral epicondylitis, big thing that we can fix right off the bat is the golfer's grip. So when you come here and you approach your club, the big thing is we see a lot of people doing is they'll have their hand turned too far forward over the club, or they'll have a weak grip where it's too far under the club. So the big thing is having that neutral grip. You'll have a V at the form of here, and you'll have a V here. So as a right-handed golfer, you want those V's pointing straight up towards that right shoulder. So by fixing that grip, that's already going to leave a lot of the symptoms that a lot of the golfers will have there. Some of the big stretches that we like to do in the clinic is just stretching out the forearm muscles. So pointing that wrist straight down, 10-second hold. You can do that about 10 times. And then you're going to turn, do the other way. So as Dr. Trevlyn suggested, a lot of the muscles on the outside of the forearm and the inside, we're going to stretch them out. And if you're golfers and you're watching a lot of golf, you always see the golfers kind of doing this little trick on the course. That again will help pronate, supinate the arm to stretch some of those muscles there. So there are a couple of the big exercises that we like to do with the patients that we see here in our clinic.
Thanks, Matt. That's real helpful. Sometimes if it's resistant to those things, we can give a cortisone injection in that part of the elbow, which can help quite a bit. And occasionally surgery is needed, but in most cases we can get this better without surgery with the proper technique and the proper exercises. The next thing I wanted to talk about was the shoulder, and with the shoulder we have the rotator cuff. The rotator cuff is the blending of four muscle groups that surround the shoulder, and that's why they call it the cuff. The rotator cuff can commonly be injured in golf. One of the ways you can injure the rotator cuff is digging too deep for a divot, or hitting into anything else that's more solid than you think it's going to be. The other thing that can injure the rotator cuff in golf is to continue playing when you haven't stretched properly. Common symptoms of rotator cuff problems are going to be pain in the shoulder, and very often that pain is lower down than you would think. Often the pain is out on the side of the shoulder here. The pain typically is made worse with lifting the arm overhead and with reaching either behind the back or away from the body. Again, rotator cuff can be either a tendonitis, which is more of an inflammation, or it can be small tears. Sometimes it's very difficult to distinguish the two, but it's very important to start with a good stretching program and again, good technique.
Absolutely. Another big thing here, when you look at the golf swing, on that takeaway, you're having that arm come across body. So with that, the big thing is looking at that posterior capsule in the shoulder. So if you have a restriction there, you're not going to get that motion across. So a good stretch that we like to do, you're going to come across, hug, and pull that right across your body here. Give it a nice 30-second hold. We like to do that one 3 times. And we're going to attack that on both sides, because as you come through with your swing, again, you can have a restriction there, and that can throw off the mechanics of the swing, as well as your back, some of your pec muscles and everything like that. Another good one we like to do, which you can do with a dog leash or a towel at home, over your shoulder, come behind and grab, and just kind of pull up on it. You'll get a nice little stretch there, and if that's too much of a stretch, you can drop it behind and pull across this way. So some of the other big muscles that you want to work on when you're looking at the shoulder are the muscles around the scapula. So big ones that we like to call here blackburns are on a table, floor, bed, couch. And you're going to just come up, 6-second hold 10 times there, out to the side, 6-second hold 10 times, up out in front, same count, and then back at the side. So you don't only want to look at the shoulder, but you want to look at some of those back muscles that can kind of come into play, because you need that scapula moving with the shoulder for the proper rhythm there.
Thanks, Matt. That is really key to point out that scapula in terms of controlling the shoulder. There are some people where once they do all those exercises, they're going to do fine, and other people will have some lingering pain. It's important to realize if you have lingering pain despite doing all the proper exercises and therapy, that you contact the doctor, and sometimes that's when we need to get an MRI to look for a tear. The third thing and last thing that we wanted to talk about was the low back. And another very common injury in golf is a low back injury. There's muscles that line the spine, there's muscles that come out from the spine to attach down onto the pelvis, and there's also the bony aspect of the back with the vertebrae, and in between each vertebrae a disc, which is where all the nerve endings come out of the back. So we can have different types of injuries in the back. Some can be just muscular injuries. A typical muscular injury is going to be just a pain, a pain in the back. It's either going to radiate to the right side or the left, or sometimes it's going to radiate out to both sides. But it's important to realize if the pain is extending all the way down your leg, if the pain travels down the back of your thigh and all the way down to your calf or your foot, then that could be a disc problem. That could be a pinched nerve. And it's important to let your doctor know about it if you feel the symptoms of a traveling pain. What we wanted to talk about today, mainly though, is how to prevent those kind of back injuries. How can we go out and golf and prevent us from getting into trouble with that type of pain?
So big thing here, which people may not think affects the low back with the golf swing, is a lot of golfers, when they approach that stance, they have a forward grounded posture here, which then is going to cause tightness in your pec muscles and loose lower traps. So 2 important exercises and kind of working that out is, one, I'm going to step over here to the door. Then you can do this at home, just arms on the door frame, and you're going to step into it. So that's going to be a 30-second hold. About 3 times you'll get a nice stretch right across the pecs there. And then the next one, grabbing the door frame, and you're going to lean into it. Now with that one, you're going to get a nice stretch across the low back. That can kind of combat some of the symptoms that you may be having when approaching that golf stance there. Another nice easy one that we do in here too, just to kind of get some of the lower back muscles on a table or on the floor. Just kind of coming down into it. So that's a great stretch, because you'll get the low back, as well as with that stretch you're going to hit some of those shoulder muscles up there as well. Big thing with a lot of these injuries that we discussed is rest and ice. They're big there because, as Dr. Trevlyn was saying, a lot of these can occur from overuse. So we really like to enforce that in here as well.
That's an excellent description, Matt, of all those great exercises, and hopefully that's going to help everybody watching here. It's important to know that if some of these things are bothering you, that you can come see us anytime. We're here at Premier Orthopaedics. We're in Broomall, but there's Premier locations all over Delaware County and Chester County. We're on the internet, so just look us up. If you need to make an appointment, very simple. And also we have physical therapy centers, again, scattered all over Delaware County and Chester County, where you can get guys as good as Matt that will go over everything with you and help you get through it. And don't forget to stretch real well before you get out there.
Absolutely.